Good morning, everyone. We hope that all of you are doing well. We want to welcome you to the Pasadena Chamber of Commerce to our weekly webinar series. And we are so excited to be able to host some of the superheroes and the rock stars that are in our healthcare community throughout the city of Pasadena. So welcome to the State of Pasadena Healthcare. We are so excited to be able to bring this amazing group of people to you. And so with that being said, just want to remind you guys, of course, we're in, week 8 or 9. You lose track of time during this COVID-19 that many of you have been on probably by now, at least it seems like 100 to 200 Zoom conferences or meetings throughout this COVID-19. So hopefully you all are used to the way that the format goes, but we did want to just make you aware that each one of you are muted and will be muted throughout this conversation. We do ask you to please use the group chat if you would like to submit any questions. We're hopeful that by the time we get through our presentations and hear the conversation through the 5 panelists that we have today, that we might have a little bit of time to participate in some Q&A. So please feel free to participate in the group chat. We always encourage and invite each of you to take the time to do that. And at this time, we want to just continue to let you know that we're gonna, as you know, the chamber staff and the board of directors here are just a pretty amazing group of people. And so we are gonna continue to be at the forefront of looking at information and resources and bringing you content that is relevant for right now, for the moment. So please continue to go to our chamber website, look at our COVID-19 page, and of course, hopefully you're signed up to receive our emails and you're looking at us on social media to be aware of all of the upcoming webinars that we want to continue bringing to you. So we couldn't do what we do without the sponsors that we have, of course, our Diamond and our Platinum members. So we do want to take the opportunity to recognize our Diamond members, which of course in 2020, we added this level of membership to the Pasadena Chamber. And of course, we have some pretty significant Diamond members. So we do want to take the time to recognize them, which of course are Chevron, Phelps Insurance, the Port of Houston, Miles Service, Chevron Phillips Chemical, and of course the Serrano Agency. So thank you so much to our Diamond level members here at the Pasadena Chamber. We so appreciate them. And of course, we want to recognize the Platinum members as well. So you should be able to see in front of you, we have a lot of Platinum members. And so there's some significant people who are here on the list, which of course are actually some of our panelists or some Platinum members. So thank you so much to each and every one of you. Literally, we could not do what we do without without the participation and these people who are in front of us. So we do want to go ahead and jump into our panel conversation. We want to give each of them the time and the opportunity to share just relevant information as it pertains to COVID-19 and what they're seeing right now within their communities and their sphere of influence. So it is my opportunity now to introduce each one of them. And so would you please join me in welcoming, we can see Gina Bamberg, of course. I think she's got her Be Strong sign in the background in her building. So thank you so much, Gina, for participating and being with us today. Of course, many of you already know her. She is one of the superstars of our community. She's the CEO of HCA Houston Healthcare Southeast. And then of course, we have Stephen Foster, who is the president and CEO of Chi St. Luke's Patient Medical Center. So glad to have you with us today, Stephen. And then of course we have Tommy Heisler, the Chief Medical Officer over there at Houston Area Safety Council. So thank you so much for being with us, Tommy. And then we have Dr. Victor Sims with us as well. And he is the Chief of Internal Medicine at Kelsey-Seybold. And then of course we have John Schweitzer. Good morning, John, who is CEO of the Pasadena Health Center. So we are just so honored to have this group of people with us this morning to, again, share the state of healthcare in our community and our region. So at this time, I'm going to turn it over to Christina Womack. I'm the president and the CEO of the Pasadena Chamber, and she is going to launch our panel discussion. Thanks, Christina.
Thanks, Melinda. Good morning, everyone, and thank you to our panelists for being here. So the way that we are going to structure our conversation in hopes of getting as much information as possible related to the state of healthcare specific to our Pasadena community is by hearing from each of our healthcare experts and some general remarks, and then we have some pre-prepared questions of things we had received from you all in advance that we have asked each of our panelists to answer, and then again we will leave some time at the end. And so we will start in alphabetical order. So we're going to start with Ms. Gina Bamberg from Houston Healthcare, HCA Houston Healthcare Southeast. I'm going to get that full title down, new name.
Good morning. You can hear me fine?
Okay.
Perfect. Okay, I'm sharing my screen here. I just have a few slides that I thought I might share with you. Certainly, we all know that we are living in unprecedented times, and it's been a really interesting time to be a hospital CEO. I'd like to give you just a few glimpses from my vantage point, kind of at what we've been looking at. Not a lot of data, but some things I do want to show you. So this has been something we've watched very closely. This is PUIs, persons under investigation, and positive daily census. This is all Houston area facilities that are reporting. So we kind of understood what the city looked like, and we could see who was COVID positive and were they in the ICU or were they in med surg. So that was very interesting to kind of look, and you can see the trend there as it goes down, kind of day by day and week by week. Here's another interesting thing that we looked at. This slide shows disease prevalence compared to other areas of the world. So this is something I really watched obsessively. You can see cases per 10,000. We looked at this thinking that South Korea was going to be our best case scenario, and then Italy would be our worst case scenario. And then time went by and time went by, and then everyone knows that New York became the worst case scenario. But this is something that we watched every day. Here inside my facility, we tested so far as of this morning, 1,020 patients, 922 have been negative. That gives us a positive rate of 7.8%. We have had 2 mortalities here at my facility, HCA Houston Healthcare Southeast. I do want to talk for just a few minutes about kind of a day in the life of someone that works in a hospital during times like this. This has been a really tough job for everyone in healthcare. As a CEO, I feel like my #1 priority is to calm fears and anxieties and over communicate. CDC regulations, things were changing every day. So we decided to set up incident command. There was an officer of the hospital here in the hospital from 6 in the morning to 9 at night. I think communication is one of the most important gifts that I can give. And so we created a daily update directly from me that went to every single physician and every single employee that works here through an app called GroupMe. Every day in Incident Command, we started with an administrative meeting that looked at PPE counts and PUIs and dealing with CDC recommendations and what's the latest information, lots of rounding, and really just managing the day in the hospital, the operations much more closely than I would in regular times. One of the things that we did is we set up what we called a hero strategy. Instead of keeping positive PUIs or positive COVID patients in our hospital, we followed the World Health Organization's recommendations regarding cohorting. So HCA has about 18 hospitals in Houston. We designated a couple of those hospitals as hero hospitals. And when a patient became positive or entered our emergency room or found us in some other way, we would send that patient to our hero hospital so that we could cohort all the patients, save PPE, let the physicians become experts in caring for these patients, et cetera. So what did a day in the life of a healthcare worker look like? Everyone, we changed all the entrances to the hospital, condensed where you could only come in and out one door. Everybody got their temperature checked when they came in. Everybody got a daily mask. Fortunately, you've seen lots of things on the news about PPE. Our PPE counts are very strong and they continue to be. In fact, we have a 60-day supply on hand and then another 90 days in a warehouse just in case this comes back, God forbid, in the fall. Very early on, we made the difficult decision of cutting visitation, really except for extenuating circumstances or laboring mothers. That has since opened up slightly, but visitors come in and they go through the very same process of screening, et cetera. This time is very tough for hospitals financially. Volumes are very different. Elective surgeries were cut. So one of the other important things I believe that I could do is let folks know how we're doing financially and how can we respond to this. So we haven't furloughed or laid off anyone, which I'm very, very proud of. Many healthcare workers have. We're paying our employees who are flexed home, we're paying them 70% of their pay. If they do become positive, whether they caught it at the rodeo or wherever, they're getting paid to quarantine at home. We're offering hotel options, scrub laundering, all kinds of things for our employees. Safety of healthcare workers has been another really big topic. So this has been evolving. When you intubate a patient, that's really the biggest risk of exposure. And so there's been lots of energy around PPE and intubation safety. You can see here, these are intubation boxes. This is a different type. This is a nurse and an ICU intensivist testing out this box. This is a mannequin, not a patient. But we have done lots of simulations around making sure that we're safe. And then once you make sure everybody's safe, I really like to try to have fun at work. So we celebrated National Banana Day a couple of weeks ago. You can see us dressed there as bananas. We greeted everyone as they either came into the hospital or went home for the day with a banana. And then our chef turned it into banana pudding for lunch, which was fun. Then the masks, I mentioned earlier that we have masks. Everybody gets a mask every day. Those masks are bagged. So we started hiding golden tickets in the mask bag, kind of Willy Wonka style. And if you find a golden ticket, you can come and get your selection of Godiva chocolate. So that's been pretty fun. Another thing that's been really interesting is when stores started to cut hours, our staff couldn't get what they needed. About 86% of our employees are females, and that means they're moms and they're taking care of their house just like they're taking care of our patients. So we set up a grocery store inside the hospital. We sold all of these things to our employees at cost. Certainly at the beginning, the most popular thing was toilet paper. Now it's turned into produce and other things like that. So we're happy to be able to offer that. And then we also brought in haircuts. Actually, the chamber was a big part of that. I called Christina and said, my people have everything they need except they're shaggy. We need haircuts. And I think that'll really be a big deal here. So Christina helped me find someone through Phelps Insurance who came to the hospital for a 2-week period and did haircuts by appointment. This is one of our physicians who took advantage of the haircuts. So we're very happy to do that. The community has been extremely supportive, and I'm very proud of that. We've gotten lots of food. We had a prayer event in our facility parking lot on Good Friday. We've had pastors pray for us by name. We've gotten anonymous flower arrangements. Texas Roadhouse fed every single one of my employees. 4 donated face shields, just on. And I'm very, very proud of that. And one of our favorite things has been Deanne Powell from Pasadena ISD sent me 454 pieces of art that Pasadena ISD students had made for us. And we're very, very happy to share that with our team. So now our mission is to reboot slowly and safely. We're doing several hundred elective surgeries a week, and things are coming back to normal. So I'm very, very proud of that. And I want to thank you again for inviting me to participate. So I'm going to stop my share here. There we go. Thank you.
Thank you, Gina. I think, you know, the leadership that you've provided and just helping focus on the mental health of your employees is certainly instrumental into making sure that they feel safe in the work that they're doing. And, you know, mental health has been an ongoing conversation across first responders and employers and families at home with their kids that haven't been able to leave. And so how else did you cope with ensuring the emotional well-being, would you say, in terms of making sure that your employees' needs were met? And was it different based on what role they played or which facility that you managed?
Yeah, really what we've done is I felt like I've had to stay very close to my executive team and manage their pace. You know, I told you we were here from 6 in the morning until 9 at night, and that's 7 days a week. And that was through however many weeks this has been, 7 weeks or so. And so starting with the executive team and then going down to the leadership, we've really focused on making sure that we are giving people time off to go home and decompress. Obviously, we're queuing into people's mental status from what we can see, but of course there's a lot of things that you can't see, and people are very good at hiding things. And so we have offered 5 free sessions with a counselor, kind of via meeting like this. We've also have a free 1-800 nurse care line. We have what's called a breathe room inside the facility with recliners and soft music and doodling stations. We have had EAP, Employee Assistance Program, meetings on site, so free counselor sessions face-to-face. Those are happening as well. Starting actually today, 9 local pastors are coming on site to pray for us, pray with us, pray over our prayer box. So I'm super duper excited about that. We have free telemedicine, doctor on demand for our team. And something that's been really popular is free access to Sitter City. So I mentioned we've got lots of moms, lots of people trying to run households, not to mention that kids are at home and they're trying to teach after they nurse. And so we have this Sitter City subscription where people have free access to sitters, whether it's for kids or pets or parents or whoever needs help being taken care of while you're at work. So I feel pretty good about that, but that's certainly one of the things I would think that keeps me up at night is the resilience and the mental status of my team.
Yeah, that's great. One of the things that you said made me think we have many attendees who are logged in today who obviously represent other industries and small business. And so I'm curious, are there any resources? I think you probably gave several of our small business owners and managers ideas of things they could be doing in their offices. Are there any resources you would share for businesses of services that you guys are offering that's available to other business?
Not of this type. Really, I've been focused on clinical care for the community and the kind of the mental resilience of my team only. So yeah, no, I don't.
I think some of our other panelists might have some of those things that could be of help as well. So as we make our rounds, if anybody else has something potentially to share in that regard, we can certainly make that available also. So thank you so much, Gina, for all that you are doing there and for sharing all of your ideas.
Thank you.
All right, well, we will move next to Stephen Foster, the CEO and president of CHI St. Luke's Patients Medical Center. Stephen, I will turn it over to you.
So again, thank you for inviting me on to the panel with some very esteemed colleagues alongside me. We share many of the items that Gina reported as well. Being on the front lines is certainly something unprecedented in any of our careers, I believe. So the one thing I would change in the intro, though, would be that we are not the heroes. I think our staff and physicians that are battling this disease are certainly the unchallenged heroes. They certainly have been in all aspects. So at Patients Medical Center, we've tested 300 patients since it started, and it started, believe it or not, early March. And yeah, that time just has flown by and it's a blur. Since then, we've had 32 positives. That includes those patients that came in through the ED. They're not really at the state that they need to be admitted. So most of those have been discharged and obviously reported to the health department to maintain surveillance. We've had 243 negatives. That puts us around a 10% positive rate, which is a little bit higher than what Gina reported, but still on par with what we've seen from a national perspective. From a COVID inpatient standpoint, we've had 4 critical care patients, and we have had 1 mortality. And I'll circle back on some of this because what's come out of this pandemic and true crisis is the beautiful stories and the endearment of just being connected to one another. So I'll circle back on that. This certainly has changed our hospital. You walk through our hospital today and it doesn't look like it did 3 months ago. We converted one of our wings to a COVID-only unit. If you think of the scene of VT where everyone is in tents and it looked very sterile and people walking in and out, that's what a COVID unit kind of looks like. And so we have 11 negative pressure rooms, meaning there's no outside air being being vented. Everything is contained within the room. And from our ICU perspective, we usually, pre-COVID, we run with 1 negative pressure room ICU. We had to convert an additional 3 rooms to that negative pressure standard to manage the critical care patients. And we actually looked at our surge plan to say what else could we convert. And so we've had to go through some exercises to say how many vents can we use, how many anesthesia machines could we convert to the vents, and how many additional negative pressure rooms could we use if we actually had to go into a surge capacity mode. So a lot of neat things that have occurred since the onset of this pandemic. But as you might expect, the innovation was key for all of us. When Governor Abbott's executive order came through to stop all elective cases, that impacted about 150 surgical staff that support the surgery areas. So we quickly had to figure out, how do we keep these very important, highly skilled staff doing something. And so we worked through cross-training events where we trained nurses that are, obviously a nurse is a nurse, but to move from PACU to critical care, there are additional skills and competencies that they have to take on to be able to be proficient in different areas. And so we did that very quickly to try to keep their hours. And of course, there was a lot of new things that Gina has already mentioned, such as security entrances and screening of all staff and physicians. All those things were things that were foreign to us from a hospital perspective, and we had to quickly implement. One thing I want to underline is the incredible partnership that we've seen between nurses and physicians, and certainly administration. It's been absolutely incredible. And of course, I'm biased, but again, I want to emphasize that the frontline staff are the heroes in every sense of that definition. Currently, we're on a slow restart as of May 1st. We are opening up outpatient and elective surgicals as per the lifting of the executive order by Governor Abbott. So things are starting to pick back up. And we can talk about that later, but I want to end with this. One of our company values is supporting and promoting human kindness. And the stories that we've heard come through this pandemic have just been heart-warming and heart-touching. For example, when you cannot have visitors come see you because you have COVID, it creates a huge barrier between the patient who's got their own challenges and the families who are there to support those patients. And think of that from a parent who's admitted into a unit and can't see their kids. So we had to create vehicles from which, how do they connect with one another? And that, as you know, when you're at home with your family, you feel a lot better when you've got the ones that love you nearby. So we created email vectors so that they could communicate. We've done FaceTime visits, and so that has been now incorporated into our daily care process for these patients who cannot reach out and touch their loved ones. And I'll end with a great story where recently we were privileged to be on the Houston Chronicle with one of our very own ED nurses. As the article quoted, he's the Navy SEALs of nurses, and I could understand that position because day in, day out, they come in braving at the front line, and at the EDs particularly, you have a lot of patients that come in that you don't know whether they're COVID positive or not, and you have to take care of them. So it's a truly great article, and then it shows kind of this heroic nature of nursing, all nurses, regardless of where they work. And so we were honored to be featured in that Houston Chronicle article. Finally, the last story I'll end with is one from our nurse named Cassie, who received a letter just earlier this week from a family member from the patient actually passed away, and the highest level of honor that she received was as a extended daughter of the patient who passed because she held the hand of the patient as he passed, because of that distance of having to be separated from their family. So I think that underlines the value and the human compassion that we have to have during this time of just terrible disease. So with that, I'll stop with the summary.
Let me pull myself together here to keep talking after that. I think that is such a beautiful example of just how our community has shown up and cared in so many ways. And so I think it was early on that nobody really comprehended the patient side of the experience during this. And everybody was talking about the first responders and the nurses and the folks who were treating patients, but the reality of those patients unrelated to COVID that were sitting in the hospitals, I think was certainly not on the front lines of folks' minds. And so you talked a little bit about this, but how do you think that it will continue to change moving forward for the patient experience of folks coming? And I'd probably subsequently add to that also, Stephen, you know, what can we share with folks who maybe delayed an elective surgery or put off coming in? You know, what can their experience be expected to look like? And, you know, I think a lot of folks have questions around, is it safe for me to come and to go back and start having those procedures? And so maybe if you can speak to some of that.
Yeah, so truly, again, unprecedented time in any of our careers, and having to restart hospitals, particularly in elective cases and outpatient services, something we've never really had to do, other than, you know, you think about those Hurricane Harvey events where you certainly, if you had to close or stop business for a little bit, you have recovery measures that we're used to doing, but not under an epidemiological event like this. So we've taken a lot of time to work with certainly our academic partners with Baylor College of Medicine, and we've got subject matter experts from infectious disease. Being part of a bigger company of Common Spirit Health certainly helps because you have tremendous resources and subject matter experts even on that level that help guide us and provide, you know, here are the protocols coming out. And certainly you have to have the requirements from Governor Abbott's executive order, meeting those 5 conditions of, you know, capacity. We have to realize we're in a world where we still have COVID patients. I foresee us having COVID patients moving forward until there is a viable vaccine, right? So how do you maintain COVID-only areas and still have safe areas for non-COVID patients? And so we've had to redesign our lobbies and our waiting areas and even our care areas to have COVID-only areas and then non-COVID areas. And then even people that work within those areas can't cross cover. So that's created just a logistical challenge to do that. So again, a lot of work to have a phased restart. We looked at first opening up emergent and urgent surgeries first, and those are very gray areas of definition. We've enacted universal masking policies, which Gina mentioned in her response. We've started almost a universal testing requirement for COVID tests. In other words, if you're coming for certain surgical interventions, you're going to have to get tested for COVID. We do that for your safety. We do that for others' safety, certainly for the physician and staff safety as well, of how, you know, we're going to interact with those patients. Visitor restrictions are still in place. Although we've loosened those, we still have to abide by those social distancing requirements. We've rearranged our lobbies. It looks different. Everything is spaced out. It looks like, you know, a big home with very little furniture. And we've done that just to make sure that we have emphasized both physical and visual cues to indicate that we are still under abnormal conditions. In addition to that, we've added new disinfection protocols. So even in public spaces, we're cleaning those areas every 15 minutes And so there's protocols that we've built just to make extra sure that we've created a very safe environment. Lastly, I'll say is you can't have elective and this restart going on if you have a flare-up of new COVID patients. So our monitoring dashboards are reported daily. We look at the same things Gina mentioned, is from a national perspective, from a local perspective, from a Harris County perspective, and certainly what are we seeing within our specific facility. And do we need to put the brakes back on to say, all right, well, maybe we need to slow down on outpatient visits again because we're seeing a flare-up come. So all those things are put into the bow to make sure that we have a safe environment for any patient trying to come in.
Thank you so much for those updates. I think probably everybody else is like me, trying to write down as everyone is talking and sharing everything as much as possible. So as a reminder, this is being recorded. So if you're the type A not getting all the information down, it'll be available for you.
Happy to send something to you, Christina, on what we've done at Patients Medical Center if you'd like.
Awesome, that'd be great. Thanks, Stephen. Okay, well, next we will move into a little bit different space with hearing from the Chief Medical Officer, Dr. Tommy Heisler from Houston Area Safety Council. Tell us what's going on in way of occupational medicine and how the council and global health has responded and y'all's current status.
Thank you very much. Good morning, everybody. First, thank you to the Pasadena Chamber for hosting this. I think sometimes we get to hear what the United States as a whole is doing and how we all are faring, and then we can get down to the state level, how the state as a whole is faring, and then maybe down to the county level, but sometimes it's difficult to get some updated information on how our own backyard is doing. So I think this is a great webinar to talk about some of those things. The Houston Area Safety Council has a mission of building safe workplaces. So we're a little bit different in that we're not a hospital. So we are not seeing sick people. What we are seeing, and what we do see on every day that we are open, is the healthy worker that has to go to work. So we in the Pasadena area, in the Houston area, are fortunate in that we live in an industrial hub where we have the greatest petrochemical ship channel in the world. We have the greatest port in the world, the Port of Houston, in this local area. And those sites don't operate themselves. They don't maintain themselves. They require tens of thousands of workers to be in those sites every single day, 24 hours a day. So the job of the Houston Safety Council is to make sure that those workers are trained and healthy to go into those job sites. The last thing that any job site, whether it's a local grocery store all the way up to a major multi-billion-dollar petrochemical company, is to have a positive case of COVID inside their site that could potentially shut down some sector in that refinery or grocery store to where that piece of the infrastructure stops working. That's the last thing that can happen. So the Safety Council has been deemed an essential job sector, not only by Homeland Security, but also our own Harris County Commissioner, to make sure that these workers are still trained. We saw back in 1989 with the Phillips explosion on the ship channel, and then a few months later with the Arco explosion on the ship channel, that those explosions and catastrophes boiled down to lack of training. The worker didn't understand what they were doing, and then subsequently a catastrophe happened, killed dozens of people. So we can't have that happen. Even in the midst of a pandemic, workers have to be trained. They have to be trained to do their job, so nobody in our local community suffers another explosion, right? So the council has done its part to make sure that we keep our doors open, that these workers are able to get the training that they need so they can go into those job sites. The job sites can work effectively without any hazards and any major issues going on, but moreover, that those workers can get a paycheck and support their families. So we are still seeing a over 1,000 people a day through our buildings here. So that means 1,000 workers going to work every day cumulatively. So we want to do our best to maintain our doors are open. We have had industrial hygienists come out to make sure that we are doing our part. We've had the Harris County Health Department come out to give its blessing on our infrastructure, making sure that we're doing our part to make sure these thousands of people that come through our doors every day are getting what they need, but getting it done safely and healthy. So we, just as Stephen and Gina said, in their hospitals, it almost looks like you're going into a hospital when you come to our facilities. We're making sure that you get screened at the door with temperature checks and the health screening questions. We are highly recommending that you wear masks inside of our training facilities. We're mandating that you wear masks in our healthcare facilities. You have to stay the 6 feet apart at all locations inside our buildings. We put up partition walls in all of our safety training stations. We've tried to go over and beyond to make sure that when you come to the Houston Safety Council, you're going to get what you need, but you're going to get it done safely. And by adhering to all of the CDC, the county, the state recommendations, we can assure that the worker is going to leave here, get what they need to go do that job at that facility, but that they leave here safely. I'm also proud of the Safety Council in that we have not furloughed any of our staff. Everybody's getting paid 100%, which is crucial, I think, in this time. We have to make sure that we're not only taking care of our trainees and our customers and our clients, but also we're taking care of our own families and our own staff. So we're going to do as much as we can to stay open as much as we can to make sure that these workers are getting what they need and that our local community is supported. One of the the backbone of Pasadena and our Houston area is our industry, and I'm happy to say that the Houston Safety Council is a vital part of keeping that industry open.
Yeah, I think, Tommy, just your explanation helps people understand the significance of the Safety Council as well as global health, but I'm sure that not everybody understands really how global health operates and the occupational medicine side of the Safety Council. And so can you explain a little bit of that and also whether or not the services offered there are open to the public or are just for employers who are partners of the council?
Sure. So our occupational health center through Global Health is solely dedicated to occupational medicine. So we are board certified in occupational medicine, and that is our specialty. So we have not opened up services to the general public. They are solely geared to the well-being of that worker, to make sure that the worker is safe, the worker is healthy. What we're seeing all across the world right now is that when workers are home and not working, what do we see? We see an increase in substance abuse. We see an increase of mental health issues. So our focus is on addressing those issues with those workers. There are a lot of mandated requirements that governing agencies put out as far as what you have to test for and screen for in a worker. OSHA gives regulatory standards. NIOSH gives standards. So our facilities are geared to making sure that those workers meet those standards. So we know that when they go to that job site down the street in Pasadena, that they are fully safe, they're fully healthy, they're not taking medications that they shouldn't, that will put them at risk, and subsequently put all of us at risk because that's right in our backyard. So our facilities are dedicated only to occupational medicine. So we give all of our focus on the worker, and we're not having to, see sick babies, sick patients. That is, we defer that to our experts at St. Luke's and to HCA. So those people are getting taken care of at the community level, but we are focused solely on the care of the worker.
Great, thanks so much, Tommy. I think that's a great segue to hear from Dr. Sims, who focuses on meeting the needs of the community as well in terms of from a primary care standpoint. And so Dr. Sims is the Chief of Internal Medicine at Kelsey-Seybold Clinic here in Pasadena. And so Dr. Sims, what can you share with us about Kelsey-Seybold?
Thank you guys so much, Christina, first for the Pasadena Chamber for hosting this webinar, and thank you guys for having us. I'll tell you a little bit about Kelsey first, and then specifically about our Pasadena arm and Pasadena Clinic. We are a physician-owned multi-specialty clinic of about 450 doctors. We have about 24 different clinics around the greater Houston area. And over 25 different specialties. And in addition to that, we probably have another 3,000 employees that work for us. That's nurses, front desk people, administrators, and have been serving the greater Houston area since 1949, when we were first brought together by two doctors, Dr. Mavis Kelsey and Dr. Seybold. I'll tell you, our community commitment has been huge throughout the whole time we've been here. We service and take care of over 600,000 lives in the greater Houston area. And definitely, as everybody has mentioned, this has been unprecedented times as we've watched what's happened with the coronavirus pandemic. But I'll tell you, one thing that I'm really grateful for about Kelsey is that we've been resilient. We've always been resilient in the face of catastrophes, and this isn't the first one that we've gone through, and obviously it probably will not be the last. We had Hurricane Harvey, and we've had everything from Tropical Storm Allison forward. But each time we go through one of these, we've learned. And what we've learned is to be able to be flexible, to be nimble. And the main thing is still be tied to and committed to our patients. And I think that's been the biggest thing that's helped us. I've heard some great presentations from the hospitals and also from Mr. Heiser, from Dr. Heiser, about how they've been able to still take care of the people and patients that they look after during the middle of the pandemic. And I think the first thing that happened at Kelsey is when this first started is we also set up an incident command at our main campus with lots of communication from our board of directors and from our vice president of operations, who's our command officer at our incident command center, to all of the different clinics around the city where Kelsey operates. And we set up daily COVID updates and teleconferences with valid information, not only from the CDC and the World Health Organization, but also from the state, from the governor's office, from the mayor's office here in our different cities where our clinics are, including Pasadena. And so we had lots of real-time information on what is the status of the spread, how many patients do we have, how many hospital beds will we need, how many ventilators will we need, but at the clinic level also, how do we get access to our patients? And one of the first things we did was almost go completely virtual. During Hurricane Harvey and some of the previous high touch points where we've had big catastrophes happen, we've been able to still reach out to our patients through telemedicine. And we continued that. Video visits were made available to our patients, as well as phone visits and electronic visits, even by computer. And one of the things about a clinic is being able to reach out to patients that are still needing to have medications refilled, still are getting sick. You know, just because we have the coronavirus here, it doesn't stop or alleviate the fact that you still have patients that get sick, that still need emergency surgeries, that still have colds, that still have, you know, the flu, even in the middle of this whole coronavirus pandemic. And what virtual health and what telemedicine was able to offer us was the ability to provide that care still from your doctor. And Gina and Stephen, as well as Tommy, have mentioned that one of the devastating things about this coronavirus pandemic is it takes away the human touch, the ability to be able to touch your patients, to be able to be there when they're critically ill. What telemedicine has done is been able to give us a little bit of a bridge to that gap. And so many times, especially my seniors, if they could see my face and I can talk to them and advise them on what to do with their illnesses, that was a great thing. And you have to also imagine in our clinic, not only do we have patients in an ambulatory setting, we also have patients in the hospital. So each day as the head of internal medicine, one of my jobs is to find out what's our hospital status. And we use the CHI Baylor St. Luke's Medical Center Hospital as a hub, closely also across the street with some of the patients here at Patients Medical Center, St. Luke's patients across the street. And so being in touch with the hospitalists that work in those hospitals, knowing what the hospitals are doing. And then our other big task here in the clinics was to make sure that what we had was a safe environment. At first, just purely virtual, and then being able to bring in the patients that you need to in a safe manner. And what we've been able to do is set up a universal masking protocol within our clinics, double down on how we clean our clinics, our intake, how do we do triage and find out what patients need to come in? How do we mask our patients and get them into their lab and to pharmacy and to x-ray safely? And so the process at which we've been taking care of patients has changed, and it's had to in order to be able to provide a safe environment and still be able to take care of patients like we need to. And then slowly, as the state has been opening up, we've been implementing all of those processes and procedures to get our patients back into us safely. We're still managing our upper respiratory tract and respiratory tract infections virtually. And one of the big responsibilities of an ambulatory clinic is also to manage your COVID patients. In addition to our incident command, we also had a centralized COVID team at our main campus that help the local physicians manage patients that were suspected to have coronavirus, to be able to get them in centrally to our main campus to get testing, and also to provide some testing and some help for the community. Some of our police departments and fire departments, first responders that you want to get tested soon, so you can put in place the CDC's guidelines to get them, first of all, taken care of and safe and make sure that they're healthy and strong, and then get them back into the workforce. Because when everything goes down, that's when your hospitals and your healthcare providers, your doctors and nurses, this is the time when we're called on to step up. And I will tell you, one of the things I'm so proud of and honored is to be a physician at this point in time. It's a scary time, but at the same time, it is a blessing and an honor to be able to still care for people and to take care of them when they need you the most. And so I've been really proud about how we've been doing that. And we've been mirroring the state as far as they've been able to open up to certain groups and starting to bring our patients back in slowly. Last week, it was 25% of our normal visits. This week, it'll be 50% of our normal visits. Next week, it'll be 75%. And we've done that in a safe manner in which we have social distancing, even when people are checking in at the front desk, sitting in our lobbies, going back to see the doctors, and at the same time preserving our PPE and with face-forward teams and COVID teams, even for patients that come in that you suspect are sick, that we isolate them to one area, logistically separate them from the rest of the clinic, be able to provide our doctors with enough PPE to be able to see those patients, to make diagnoses and then to treat them. And then lastly, one of the big responsibilities also of an ambulatory clinic is to be able to manage patients and keep them from having a run on our local hospitals. And Kelsey has been very privileged and blessed in that we've been able to manage our COVID patients without sending every patient to the ER. Every patient does not need to be in the hospital. Every patient does not need to be in the ER. Many of these cases we've been able to manage using that COVID team locally and keeping those people out of the ER and out of the hospitals and safe and quarantined, and actually still able to manage them and take care of them without sending everybody to the ER. You can imagine hospital and ERs being overwhelmed those first couple of weeks with people coming in, but not having a place to go. And that's where your local physician really has to be able to step up and provide care. And so it's been a trying time, a scary time, but at the same time, a time in which we feel like we have to step up and be able to take care of our patients in a safe manner. And so the state of the union at Kelsey is that we're still strong, still holding here, and being able to take care of our employees first, both financially, job-wise, and then also mentally being able to look after each other. So it's been a scary time, but I've never been more encouraged by what I've seen as far as the response of our healthcare workers and our healthcare industry.
Thanks, Dr. Sims. I think, one of the questions that we have seen is regarding, routine care and going back to the doctor and dealing with, just regular old Houston allergies and flus and issues. And so what can you speak to in way of, because everybody is a patient in some regard. And so whether that's for regular well visits and routine checkups, or, dealing with some more serious illness. And so what change have you seen in patient behaviors, and what message can you share with everybody here with us today about the importance of continuing to get that care?
Well, I'll tell you one important thing is that from the healthcare perspective is, number one, that we take care of our very sick patients and emerging cases. So I think the first thing is to prioritize those patients as in their need to get in to see the doctors. We still had cholecystectomies that we were performing at our ASC. We still had emergent people having chest pains that we need to triage to the hospital, is to still keep that infrastructure intact. And that's one of the things that we did first and foremost. Now what we're starting to do, as elective cases are starting to come back on board, as we're starting to bring patients back into the clinic, again, is to prioritize those. So first, emerging cases. Secondly, elective cases, and every elective cases is not necessarily cosmetic cases. You still have people that have positive mammograms that still need to be seen by the breast surgeons, that had mammograms that were diagnostic that still needs to be done. People who put off their gallbladder removals. And we run the largest ASC freestanding in the state. And so what we've done is do that procedure and do those processes safely with good prioritization. And so we tested all of our ASC employees, tested all the ASC physicians, tested all our cancer center physicians and employees, because our patients with cancer still need their chemotherapy. And the patients that need to start doing their elective services, we're starting to bring those back in. And then what we start to do, as Stephen and Gina both mentioned, we start to do pre-op testing on our patients through our central COVID team, testing those patients 5 days out to make sure that they are negative and that they don't bring infection into the ambulatory surgical center, as well as our doctors and staff. We're using universal precaution, universal masking with enough PPE. And then now we're starting to bring those patients back in by the most urgent cases down to the least, and do those cases safely. As far as wellness and the importance of still being able to do your routine work, wellness we will start back doing next week on the appropriate ages. What we've done up this week has been more so, we still have a lot of vaccine-aged children that still need to get in and get their vaccines done so they can stay on schedule. What we don't want to do is have an outbreak of vaccine preventable disease amongst our kids because they fell off their vaccination schedule. So what Kelsey has put in place is a protocol to get those kids back in to get their vaccinations on schedule. Next week, what we'll start to do is bring in some of our people that are less than 65 years of age, but still need to get in to get their physicals done and some of their wellness done over time. And what we've done with our seniors is we've done what we call virtual health checkups, or video visits, where we've kind of still been able to go through their health risk assessments, but we've delayed them coming into the clinic until in June so they can come in and actually be seen, have an exam, get their labs, and get all their testing done. And so those things are still important because disease processes don't go away just because coronavirus is here. It's a way to be innovative, to structure where you can still take care of those people. Our URIs, cough, colds, and in Houston, allergies. Here in Pasadena, we still been able to see those patients virtually and take care of them. And then as it becomes safer for them to come into the clinic, using new protocols with universal masking, et cetera, we slowly bring our patients back in. So we've been managing still coronavirus, upper respiratory tract infection, allergies, et cetera, virtually. And telemedicine has played a great part of that. But what we'll start to do is now bring in patients that need to start to get back in on their schedules for vaccinations, their schedules for their wellness as the state slowly opens up. The last group of those that will come in for wellness will be our seniors and the people at the highest risk, because we want to keep them out of the clinic for wellness stuff as long as possible until it's safe enough for them to come back in.
Yes, I think the message is clear across the board from everybody so far, is that it is certainly safe to go and important to continue to seek care. And you might not be in person and it'll look different like everything else, but no reason to delay. So thank you so much for that update, Dr. Sims from Kelsey.
Thank you all so much for having us.
Absolutely. Okay, so we are going to round out our panelist discussion with the CEO of Pasadena Health Center, John Schweitzer, who can give us an update also on private health and what's that looking like on the clinic side as well. Dr. Schweitzer, thanks for being with us. Oh.
had a chance to be on both sides of this situation. A lot of people don't know it, but on December 24th, I had a seizure, and because of that, I had to go into the hospital. It was an interesting opportunity for me because I had to go to St. Luke's Hospital. I'd worked in the medical center for 16 years prior to coming out to Pasadena Health Center, and I walked into the hospital and it was literally empty. I've never seen anything like it. It looked like a horror movie is about the best way I could describe it, because you were all alone and there was nobody there. I told somebody if you took a baseball, you could have thrown it from one end to another and not hit anybody. It was amazing. So that was the first time as on the family side of being without my wife, being without anybody with me, and going into a hospital situation. So it was very interesting. Then just recently, I had heart ablation at a local hospital, and I did get to have my wife with me. So it was wonderful to have her there and just to have that family support. So the family support side that they're talking about, the administrators are talking about, is extremely important to our patients, extremely important to healthcare, very valuable to recovery, knowing that people are praying for you, know that people are there for you, knowing your family's there. Can't say enough good things about that. So having them back is very important to healthcare, very important to what we do. Sometimes it's important from the physician side of just having somebody there to clarify what we said, so somebody remembers what we said, because when you're the patient, you're not thinking straight. So it's good to have somebody there with you. We have also been concentrating on the safety side. I want to thank Dr. Hessler, Tommy Hessler, because we had the sudden situation of fit testing for N95 mask, and we had to think about real quickly who are we going to call. And of course, I passed him many times on Spencer, and I thought, well, they're on Spencer, I'm going to call them. And they came right out. They got our staff tested. They did a tremendous job. We were extremely pleased. I was pleased because I didn't have to do it, so I was thrilled. And so, Dr. Hessler, thank you for your staff and for the work they did, and for helping our staff to feel secured, because it's the first time we've been in a situation where we really felt like we needed to get N95 fit tested for what was going on. Our clinic has always been an interesting place from many perspectives. We started off with Katrina. When Katrina hit in New Orleans, we got those patients, and that was what initially led to our funding. So we worked off multiple disasters since that time, and had to deal with that with our staff and with our reactions in the community. On this particular one, we've been working with City of Pasadena, with Kathy Perez with emergency management. We've worked with Harris County. We've worked with the Texas Association of Community Health Centers, and then of course we've been on the state calls. So we've had a lot of information coming through. We're trying to stay updated on the latest information so that the patients that we're treating are going to get the best treatment. And the thing that you have to keep in mind, if you're out in the community and you're wondering why do things seem confusing, if it seems confusing to us, to you, it's confusing to us too, because information is changing rapidly. It's not something that is stagnant. It changes from day to day, from week to week. And so it affects us a lot. The best example I could give you was when we had to shut down dental. It was a big blow to us. We have quite a few patients that come through our dental center. We serve the community. We have people come through that may not have any funds, and we see them for free. And so we suddenly weren't able to do anything unless it was on an emergency basis. So that was kind of a blow to the clinic. So that was tough to go through. So we're back with the dental center open again, and that's a very positive thing for us. The testing was another thing that became kind of a problem for us. We couldn't get the test up front when it first started. We were struggling to get tests in. I'm happy to tell you now that we have 500 tests in the clinic of one group, and I have 28 of the other. So we have tests. We are testing people. We've seen, I think, about 25 people so far that have been tested at Pasadena Health Center. And we have put in safety precautions, just like everybody's talking about, to make sure that it's safe for our staff, make sure it's safe for our patients, and safety is the #1 priority for everybody at the clinic. As far as the community, we have had the mobile clinic up in the area for 3 weeks. We had it going out to schools. Everybody took shelter in place pretty seriously, so we kind of had to shut that down. So it's not out right now, but we do plan to put it back out later. But we do have the mobile clinic. The nice thing about our mobile clinic, it has 4 SIMS cards on it. So our communications will always be up. We'll always be able to talk to somebody from the mobile clinic and always be able to do patient care from there. We have not, like everybody else has talked about, we have not furloughed any staff, and we've kept all our staff on. There was a couple weeks that we were going through, and I've never prayed so hard in my life that God would answer our prayers, and He has. He's come through good for us, and so things are starting to improve, and it's feeling a lot better than where it was 3 or 4 weeks ago. So some of our needs are getting met, and that's really, really important to us. Just want to say to the people out in the public and people that might be watching today, if you're furloughed and you don't know where to go, and this is not a commercial, it's just to tell you, we will take you. So I don't want you to sit at home. One of the biggest things I've seen that really breaks my heart is when I hear about people that are having strokes, or they're having heart attacks, or having emergencies, and they're not coming out. They're staying at home because they feel like they can't get out in public and can't go anyplace. We've got telemedicine, which is great, but I've got doctors that are live in my clinic, and we're going to take you. So don't worry about the money part. Don't worry about it. Just come in. Let us get you taken care of. We're gonna deal with it. We can worry about all other stuff later. The main thing right now is your health. Let us take care of you. Make sure your health is taken care of, and please let us help you, because that's what we're there for. So that's all I'm going to say, because I think our time's getting taken away pretty quick. So I'm going to cut it off at that.
Thanks, John. Yeah, it's definitely, it's such good information though. So we do want to, we've talked a lot about Pasadena, and one of the things that you mentioned, John, that I think is important to share is that, the dental practice, the Chamber of Commerce has a slew of other chamber members that represent chiropractic care and dental care, orthopedics, behavioral medicine. I mean, the list goes on. And so we could have had a panel of probably 50 different industries represented. And so it was hard to isolate all of it. I think the key is knowing that every industry has been impacted in all of this. And we know that there's valuable information to share across all of the healthcare sectors, certainly. And so one of the things that we want to make sure is all of our members know, and the community knows, is that we try to be a valuable source of information. So for any of our chamber member partners that are putting on educational seminars or information on your own, share that information with us so that we can push that out to our members as well. But we do want to spend a little bit of time talking about the differences in testing and testing sites, because I think there's in the media a lot of different information around the types of tests and what is available. And so, John, can you talk a little bit about the different test types and accuracy or testing facilities here specific to Pasadena?
Yes. Currently, this is new information as of Monday, there are 3 tests out now. There's a PCR test, which is real-time molecular activity, SARS-CoV-2 test. There is a serology antibody test. It's an IDT or IDM, and it's a test that measures if you have antibodies. And then there's an antigen test, which is the newest one that came out of Rutgers University. You'll be hearing about that coming out of the New Jersey area. It will eventually get down to our area. So the first 2 are available right now in the area, the PCR and the serology. The serology is probably one that everybody likes because it's a quick test. It's about a 10-minute test. We can do that and get the results almost immediately. There's a little short film. If y'all want to show it, you can. If you don't, it's okay. But we do have a film that we can load up real quick if you want to see it.
I think so. Yeah, I think that we generally try to keep our webinars to an hour, hour and a half. And so I think this is valuable information for our members to see. And so we'll continue. And if somebody has to sneak off, we'll allow them. So Aaron, let's go ahead and play these videos.
Okay. All right. Well, let's go ahead and show this one.
Have the patient blow her nose into a tissue to clear excess secretions from the nasal passages. Tilt the patient's head back slightly so that the nasal passages become more accessible. Instruct the patient to close her eyes to lessen the mild discomfort of the procedure. Gently insert the swab along the nasal septum just above the floor of the nasal passage to the nasopharynx until resistance is felt. Rotate the swab gently against the nasopharyngeal mucosa for 10 to 15 seconds. Gently remove the swab and place it into its container.
In this video, we will demonstrate collecting a nasopharyngeal specimen from a patient under investigation for COVID-19. Healthcare providers who suspect their patients have COVID-19 should consult their public health department to determine if the patient meets criteria for testing. Recommendations by the CDC as of March 13, 2020 are to collect a single upper respiratory nasopharyngeal swab. Personnel performing a nasopharyngeal swab should wear personal protective equipment that meets the guidance recommended by the CDC. The required equipment for the nasopharyngeal swab includes a synthetic fiber swab with a plastic flexible shaft, viral transport media, facial tissues, a flashlight, alcohol-based hand rub, EPA-approved disinfectant wipes known to kill human coronavirus, a waste container lined with a waste bag, laboratory transport biohazard bags, patient identification labels, a permanent ink ballpoint pen in dark blue or black ink, and absorbent pads. As healthcare workers prepare to collect a nasopharyngeal swab, they should be mindful that the patient may be experiencing anxiety and fear. It will be important for the healthcare worker to provide an explanation of the procedure and reassurance as needed. If there is concern that the patient may react negatively by reaching for the swab or pushing the provider away, for instance, consider having a buddy standing by to assist if necessary. If the patient is a pediatric, distraction techniques may be required. As with any procedure, ensure institutional protocols are followed at all times. To begin, follow your facility protocol for identifying the correct patient and preparing the procedure area.
Okay, that's it. What we're trying to do in the clinic, and this might help everybody out there in the community, is there was a incident in Saget County, Washington, where a choir met for 2.5 hours. They had some people with COVID-19 that happened to be at the choir rehearsal, and of course this was unknown to anybody. It was 61 people total that were in a 2.5-hour rehearsal. There was 32 confirmed cases, 20 possible cases, 3 had to be hospitalized and 2 died that were in that particular choir rehearsal. So what we're asking or telling the public, telling the choirs, telling the churches and groups to do is come into the clinic. Let us do the simple blood test that you just saw. We're not going to charge you. It's free. It's free. I'm absolutely going to tell you right now, it's going to be free. So we'll set that up for you. I've had 3 churches already call me and ask me about it. It's a 10-minute test. It's very quick. The reason we think it's a good baseline test is because if you have the antibodies, you've had an exposure. So that's why we're using that as a baseline test. If you show up as positive that you actually do have antibodies, if you're having any signs or symptoms, or if there's any indication that we need to go further, we would do the swab test. The swab test is the second test you saw. There's 2 swab tests, so if you're scared, don't be scared. There's a nasal swab and there's an oral swab. We could do the oral swab, which is a lot less painful. We're not going to hand you the swab and tell you to do it yourself and we'll walk away. We're not going to do that. We're going to stand right there with you. We're going to do the swab test, and it will not come back right away, so it's going to take a while to get it back. I've heard anywhere from 4 to 5 days before we get it back. So The key is not panic. The key is to get tested. We don't want to put you back into a church choir rehearsal or in a room with a bunch of people and have you infected and spread it to everybody. That's the biggest fear the state of Texas has right now is putting people back together in groups and having a person that's infected get in that group and spread. A lot of people talk about masks, and I'm not supposed to talk about masks, but I'm just going to say it real quickly. Masks are great if you have one that's effective. It does not protect you. It protects the people around you. So you got to keep that in mind. So getting tested is important too. I would highly encourage everybody to come get tested. Let us test you, get the baseline. If you don't have any antibodies, you're probably good. There's always exceptions to the rule, and I can't tell you there's a perfect test out there, because if I did, that would be a new thing, and I'd probably be in a lot of trouble. So I'm not going to do that. But I'm willing to do it for free. I'm going to do it as a public service to our community. I will help as many people as I possibly can until we run out of tests, and so that will be made available to people in the city of Pasadena.
Thank you so much, John. I think, for Pasadena residents and businesses, knowing that we have the resources both at Pasadena Health Center, as well as, we know all of our hospitals are providing testing, and the Safety Council is testing workers to keep them going. The Walgreens on Southmore in Pasadena is also doing testing, and we will continue to make available information around testing and where you can go in Pasadena on our COVID resources page on our website. I think another key takeaway here is trust the professionals, in that them administering the test is probably the best case scenario to ensure accurate results, and that there are tools and resources available for that. And so thank you for sharing that information. We did get one question that I don't think that we've covered that could be relative to everyone. So I'm going to ask this question. One of the questions was related to Spanish speaking only clients, and because of limited patient support or having somebody else with you in the hospital or go to doctors, what is being provided in way of the different facilities for those Spanish speaking only customers?
Pasadena Health Center has almost all our staff speak Spanish except for me, and I can do poquito.
Me too, John.
At my facility, we try to pair a Spanish-only patient with a Spanish-speaking staff. When that is not possible, we have a device. It's called Cultural Link. It's very much like a FaceTime on an iPad. 150 languages are available, and the translators can come on in a matter of seconds. So we use that. If some other language other than Spanish, or if I don't have a staff member available at that time for that patient. And then of course that iPad is cleansed during patients and all of that other kind of stuff.
At Kelsey, I'll say one of the blessings about having a diverse physician population as well as diverse staff is many people that speak many different languages. So most of our patients that speak only Spanish are paired with doctors that are fluent in Spanish, or themselves English is a second language to their Latin American or Latin or Spanish home countries. And then in addition to that, we offer interpretation services in a number of ways. And so we bridge that language barrier that way.
Echoing what everyone else has said, Christina, same thing. I mean, pre-COVID or COVID, we had Cultural Link just like Gina mentioned, and we do the same thing with our bilingual staff who we're fortunate to work with.
Great. And then I think just for the sake of time, I'll ask just one other question. Although many of the folks on the call with us today represent business organizations, we're all individuals that have some responsibility. And so I think the question is as individuals, what can we do to help keep everyone else safe? And so instead of me offering an answer to that, pulling from what you guys, I'll ask if anybody wants to answer what's the best way that folks can do their part.
I would just say pay attention to what's going on in the community. Wearing the mask in public is a good thing, but just pay attention to what kind of mask you're putting on. It's important to understand what's being said. There's a lot of information that comes out. If you have questions, please talk to your physicians or please talk to your healthcare providers. Let us clarify it for you so that you're not getting confused. The last thing that I want to see happen in our community is for people to be confused about COVID-19 and get bad information. I mean, I don't want to go into details of all the stuff I've heard, but it's just, it turns into a nightmare. And please ask us if you have a question. We have email, we have a lot of different ways. We have a Facebook page. We'll be more than happy to talk to you and try to clarify things for you as much as we possibly can. So please use those resources that we put up specifically for you if you're in the public.
All right. Well, thank you all again so much. I think the amount of information and just the available resources specific to Pasadena from everyone's comments in the chat is just an overwhelming thank you to each one of you, exceptional leaders in our community, and for the work that you're doing and how you're leading your teams collectively, as well as the many other healthcare industries that are supporting Pasadena and beyond. And so with that, I will turn it back over to Melinda for some final closing remarks.
Yeah, thank you again, each one of you. Just and Stephen, I so appreciate your comment about the nurses. I know all of you feel that way, and Gina, I mean, to Victor, to Tommy, that everybody, your teams are truly the superheroes, but superheroes have to have superstar leaders. And so it's just very humbling to hear from each one of you. And Victor, I just love your comment about how you truly believe it's a blessing and honor, even in COVID-19, for each one of you really to be in the place where you are. It is just so humbling and just very, just humbling is the word that I think of, to hear from each one of you and to just know what you're doing on the front lines. And so, of course, Tommy, I just have to speak to the Houston Area Safety Council. Thank you so much to you and to Louise, and just the vision and the mission of the Houston Area Safety Council to take care of the worker, because, you know, as we're going through this medical crisis, it's also a crisis of economy, you know, and the economic conditions. And like you guys are really talking to, just the mental, emotional impact that this is having on individuals, not just in the healthcare world, but the loss of jobs. And so thank you to each one of you. Just God has really put you in a place, in a position, a sphere of influence for such a time as this. And so thank you again for just the kindness, the compassion, the leadership that each one of you really bring to, you know, the company and the organization that you work with, but to the city of Pasadena. It is just, it's such an honor to be able to participate and join in conversation with each one of you today. So I will remind those who are still online, we did record this, so please go to the Chamber website, to our COVID-19 page, pull up the recording, share it with all of your family and friends, and of course your coworkers and those who really need to hear what's going on within the city of Pasadena. John, thank you to you as well, just for what you bring to our community in the way of helping those who really need help, and sometimes people forget. So thank you for remembering those that are sometimes forgotten. Just really appreciate that. I just really wanted to mention that. So just a few upcoming events. We are going to join again on Friday at 8:30 with our virtual coffee and conversation. So hopefully you guys will connect with us and check in and let us know how you're doing. We did want to pull up a slide of our next event, which is actually going to be hosted next Thursday, May 21st at 11:30. We are excited to be bringing to you State of Disruption, how industry is actually tackling adversity. So we're excited to have Hector Rivera join us. And so hopefully you'll go online, you'll register for that event. We are excited to be bringing this opportunity to you. Then, of course, we are going to be bringing on June the 3rd, our Breakfast with Champions. So we are going to have all of our high school principals serving on that panel again, but really want each of you to take the time and opportunity to jump on the Chamber website, to jump on our Facebook, social media page, to know what's going on as far as the recognition of the class of 2020 and everything that's going to be taking place within our city to honor all of the high school grads at all of our local high schools. So we're super excited about our initiative for the high school seniors and being able to partner with our Pasadena Independent School District. So again, on behalf of the Pasadena Chamber and myself, just thank you again, panelists, and thank you for everybody that has joined us this morning. And we look forward to connecting with you again. So thanks again, and you guys have a very blessed day.
Thank you.
Bye, everybody.
Thank you all, Melinda. Bye-bye.
Bye. Thanks again, Tommy. Thanks, John.
Thank you.